the Affordable Care Act, more commonly known as Obamacare. The supporters of this program would have you believe that this is an answer to a national crisis, that it will ensure that everyone receives adequate health care. What they fail to mention is that Obamacare is not about health care. It's about health insurance. It does not ensure everyone will receive proper care. It mandates that every American must have health insurance or be taxed. They also fail to mention the bill's convolutedness in itself. The more we learn, the more we understand that Obamacare cannot be allowed to be implemented. At this time, our best chance is to slow the process. Defunding Obamacare is the first step, a necessary step. By taking this action, Congress will be given time to chip away at this bill while we grow support for a full repeal. We know this can be done. Virginia Fox just told us in her letter, 40 votes. They had 40 votes. Of those 40, 7 times we had parts of this bill removed completely. It is possible. The cost of Obamacare to our populace is devastating. We know, just as the authors knew, that this program depended on young Americans signing up at these exchanges to fund subsidies. Currently, we don't have that population to fund those subsidies. That money must come from somewhere, from our federal government in the form of more taxes. Implementation of these taxes to pay for the IRS, to pay for the administration, including the navigators that were mentioned earlier, and these subsidies will create a strain on our already stressed economy, where we have full-time workers being cut back to part-time, and part-time workers losing their job because they don't have seniority. We have already heard that this program will fail. Senator Harry Reid himself said Obamacare will fail. The fix is a single-payer system. The most likely models here in the U.S. for a single-payer system are Medicare, the VA, and TRICARE. None of these systems work effectively or efficiently enough to be a model for a universal single-payer healthcare system. When we talk about this law, we talk about it like it only touches healthcare. In the 2 years since this law was passed, we have yet to see every regulation that's in it roll out. HRSA 12-156 is one of these regulations. This section is designed to be an extension of the child welfare program. It allows for governmental home visits in high-risk areas. It mandates that every state that participates and gets funding resurvey their state for high-risk areas. The criteria for these high-risk areas: excessive unemployment. North Carolina's is 8.9, covers most of our state. Increased drug abuse, increased child abuse, and low socioeconomic level. When they come into your home to be an eligible family, all you have to meet for criteria is to have a household with a mother under 21, a child with a disability, low academic achievement, tobacco use, or a house with a family member who has served or is serving in the military currently. That covers a lot of us. Unfortunately, we cannot at this time get a full repeal vote in the Senate. The most we can do before the October 1 deadline is to fund Obamacare. We must make this stand. We must take a stand, draw our line in the sand, and say, we go no further. This is where it stops. And this is where I stand. No further, no more, no funding. Thank you.